Nobody talked to him. For 12 years, he worked as a security guard at the same hospital, quietly walking through the corridors. Until that day when Dr. Martinez had a heart attack, and everyone learned just how experienced his hands really were. Welcome to Story Factory. Before we begin this powerful story, tell us in the comments which city you're watching from today. And if you believe stories like this deserve to be heard, don't forget to subscribe. Because sometimes, the greatest heroes hide in the most unexpected places, the corridors of St. Mary's Hospital never stopped. Day and night, patients came, doctors ran, nurses worked. And amid all this chaos, there was one man whose presence hardly anyone noticed. Frank. Frank Rodriguez was 62 years old. He had worked as a security guard at the same hospital for 12 years. He was tall, but not very talkative. His hair had turned silver, and time had left its marks on his face. He came to work every morning at 6 a.m. and left quietly at 6 p.m. His duties were simple: control the main entrance, distribute visitor passes, help in emergencies. But Frank didn't just do his job. He knew the hospital like his own home. He had memorized every corridor, every room, every emergency exit. "Good morning, Frank," the nurses would sometimes say as they passed. "Good morning," Frank would reply, nodding his head slightly. That was it. He wouldn't chat further. People saw him only as a security guard, quiet, reliable, but ordinary. But there were things about Frank that weren't ordinary. For instance, when the emergency room was busy, he would watch very carefully how the doctors worked. Sometimes he would notice mistakes the nurses made, but he would never say anything. He would just watch from afar, silently taking notes. Dr. Sarah Chen was the emergency room chief. She saw Frank differently from others, because Frank's looks were different. When faced with a medical situation, there was understanding in Frank's eyes, as if he knew very well what was happening. The same order every day. Frank would come early in the morning, do the shift change in the security room, then take his place at the main entrance. Visitors would come. Frank would give them directions. Worried relatives would ask anxious questions. Frank would give calm answers. "I came to see my father. His name is Robert Johnson. 3rd floor, room 312. Elevator is on the left." "Thank you." "You're welcome. Get well soon." These conversations were always short and functional. Frank maintained emotional distance. He wouldn't get too close, but was never rude either. When lunch break came, Frank would sit alone in the hospital cafeteria. At the same table, the same meals, sandwich and tea. While doctors and nurses chatted around him, Frank would eat quietly and look outside. Dr. Martinez was a cardiology specialist, 45 years old, an energetic doctor. Frank and he would sometimes meet in the elevator. "How are you, Frank?" "I'm fine, doctor. How are you?" "Busy day. Surgeries one after another. Take care of yourself." Dr. Martinez liked these conversations. There was a calmness about Frank. In the chaotic hospital environment, Frank's presence was comforting. Since Frank had worked at this hospital for 12 years, he saw everything. He knew how each doctor worked, which nurse was more experienced, what protocols were applied in which situations. Sometimes the emergency room would be very busy. Ambulances would come one after another. Trauma cases would pile up. Frank would be more careful during these times, because emergencies could arise. That Tuesday, the emergency room was busier than usual. There had been a traffic accident. Multiple injured people had been brought in. Dr. Chen and her team were working intensively. Frank was standing at the main entrance, but his ear was on the emergency room. Over the years, he had learned hospital sounds. He knew what each sound meant. "Code blue." Code blue. Cardiology department. Code blue. It meant cardiac arrest. Frank's heart raced. Cardiology department. Dr. Martinez was there. Frank hesitated. His duty area was the main entrance. But the voice inside him was telling him something else. Then came the second announcement. All available doctors to the cardiology department. This meant the situation was serious. Frank stopped waiting. He temporarily left the main entrance to Nurse Angela and walked quickly toward the cardiology department. He had worked here for 12 years. Helping in emergencies was his duty. When he reached the corridor of the cardiology department, there was chaos. Nurses were running. Doctors were moving quickly. What happened? He asked Nurse Patricia. Dr. Martinez. He had a heart attack. He's in very bad condition. Frank's world spun. Dr. Martinez. That kind, hard-working doctor. While always taking care of others' health, it had happened to him. Where? Room 205. Doctor. Chen is intervening, but... Patricia's voice was trembling. The situation really looked bad. Frank walked toward room 205. He stopped at the door. Inside, Dr. Chen and two nurses were working around Dr. Martinez. Monitors were alarming. Pulse is low. Blood pressure critical. Dr. Chen was shouting. Is the defibrillator ready? Ready, doctor. Frank stood at the door, but the voice inside him wouldn't be silenced. He could read the numbers on the monitors. Dr. Martinez's condition was really critical. And then the worst happened. We lost pulse, the nurse shouted. Dr. Chen immediately began intervention, but Frank saw that she was stressed and tired. She had been on shift for 12 hours. At that moment, Frank's past, hidden for 12 years, came back. Frank entered. Dr. Chen, can I help? Dr. Chen was surprised. Frank? This is a sterile area. Security. Doctor, please. I can help. Dr. Chen heard the determination in Frank's voice. This wasn't the voice of the quiet security guard she knew. How will you help? Frank went to the hand-washing sink, cleaned quickly. Then he came to Dr. Martinez's side. You're doing cardiopulmonary resuscitation, but the technique is wrong. Let me. Dr. Chen was shocked. Frank, what are you saying? But Frank was already beside Dr. Martinez. His hands immediately came to the correct position. He began chest compressions. But this wasn't standard first aid. This was professional, experienced medical intervention. 30-2 ratio, compression depth 5 to 6 centimeters, rate 100 to 120 per minute. The sounds coming from Frank were surprising Dr. Chen. Frank's hands were working as if he had been doing this job for years. Frank, how do you... This isn't the time for that, doctor. Chen, give epinephrine, 1 milligram intravenous. Dr. Chen automatically did what Frank said, because Frank's every movement, every word was professional. 2 minutes later, a pulse signal appeared on the monitor. Pulse is back, the nurse shouted. Frank continued his intervention. He was carefully monitoring Dr. Martinez's condition, vital signs, EKG readings, drug dosages. He was controlling everything. Oxygen saturation rose to 95%. Blood pressure 110/70. Heart rhythm returning to normal. Dr. Chen and the nurses were watching Frank in amazement. This man wasn't the quiet security guard they had known for 12 years. This was an experienced doctor. Frank, Dr. Chen said slowly, who are you? Frank continued to monitor Dr. Martinez's condition. What's important right now is Dr. Martinez's condition. He needs intensive care. But you... Dr. Chen, please, Let's think about the patient first. For the next 20 minutes, Frank stabilized Dr. Martinez. He performed all the necessary interventions. Finally, Dr. Martinez's condition came out of critical level. He can be moved to intensive care, Frank said, but he needs close monitoring for 24 hours. Dr. Chen nodded. Okay. Okay, Frank. Are you a doctor? Frank washed his hands. There was fatigue on his face, but also relief. I used to be, he said quietly that evening, after Dr. Martinez was moved to intensive care, Doctor. Chen called Frank to her office. Frank, we need to talk. Frank resisted. Dr. Chen, I just helped. Now I should return to my work. No, Frank. You saved Dr. Martinez's life, and the intervention you made. This wasn't just first aid. This was professional medical skill. Frank sat down. The truth he had hidden for 12 years had finally come out. Who are you, Frank? There was a long silence. Then Frank began to speak. My name is Dr. Francisco Rodriguez. I worked as a cardiothoracic surgeon for 25 years. Dr. Chen's breath caught. Cardiothoracic surgeon? Frank, you're a heart surgeon. I used to be. Why? Why did you quit? Frank's eyes filled with tears. In 2012, during a surgery, I lost a patient. Dr. Chen listened silently. A 17-year-old girl, congenital heart disease. It was supposed to be a routine surgery, but there was a complication because of my mistake. Frank, she was the family's only child. The mother and father lost their future on that operating table, and I lost myself too. Frank's voice was trembling. A lawsuit was filed. Malpractice case. I won technically, but my conscience wasn't at peace. I couldn't save that girl. Doctor. Chen understood Frank's story as she listened. What happened next? I quit surgery. I had my license revoked. I promised never to operate again. But Frank, you made a mistake. This wasn't something that should end your entire career. Dr. Chen, you can't understand. That girl's eyes, her family's pain. I see them in my dreams every night. Frank stood up. I've been working here for 12 years because I want to be in a hospital environment, but I don't want to harm anyone. Security work is safe. No one's life is in my hands. But today, Dr. Martinez's life was in your hands, and you saved him. This was different. It was an emergency. There was no other choice. Dr. Chen approached. Frank, you're a real physician. You proved it today. Even after 12 years, your hands still work to heal patients. In the following days, the story of Dr. Martinez's rescue spread throughout the hospital. People began to look at Frank differently. Was he really a doctor? He worked as a surgeon for 25 years. Why did he quit? I don't know, but he saved Dr. Martinez. Frank was uncomfortable with this change. He wanted to become invisible again, but it was no longer possible. After Dr. Martinez's condition improved, he wanted to see Frank. Frank, Dr. Rodriguez, I don't know how to thank you. No need, doctor. It was my duty. No, Frank. You saved my life. And, as a doctor, I'm telling you, the intervention you made was perfect. Frank bowed his head. Thank you. Frank, why don't you return? To medicine? I can't return. I'm not that man anymore. But you proved today that you're still that man. The hospital administration met with Frank. Human Resources Manager Ms. Williams called Frank to her office. "Frank, there are important matters we need to discuss with you." Frank was worried. Would he lose his job? "We got information about your past." "Dr. Francisco Rodriguez, you were a famous heart surgeon." "I used to be." "Frank, we want to make you an offer." Frank was surprised. "What kind of offer?" "Would you like to work as a hospital consultant? Not as a full-time doctor, but you could provide consultation in emergencies, in training programs." Frank thought. I won't operate." "No need. We just want to benefit from your knowledge and experience." Dr. Chen intervened. "Frank, think about it. Someone experienced like you could teach young doctors a lot. But that girl—" "Frank," Dr. Chen said gently, "you're punishing yourself for not being able to save that girl." "But have you thought about how many people you saved? How many lives did you save in 25 years? Frank's eyes filled with tears. "Dr. Martinez is alive now because you were here. Maybe this isn't a coincidence." 3 months later, Frank was still working at St. Mary's Hospital. But he was no longer just a security guard. He was a hospital consultant. He was training young doctors. He was providing consultation in emergencies. He wasn't operating, but he was in medicine. And most importantly, he had made peace with himself. He still hadn't forgotten that 17-year-old girl. He would never forget her. But now this pain didn't drive him away from medicine. On the contrary, it made him more careful, more meticulous. Dr. Martinez had completely recovered and was now Frank's best friend. "Thank you, Frank, both for saving my life and for teaching me what true friendship is." Frank had smiled. "I thank you, doctor. You gave me the chance to find myself again." Everyone at the hospital now knew Frank differently. But for Frank, the most important thing was that he knew himself again. Because sometimes, the mistakes in our past aren't there to stop us, but to make us better. Thank you for watching this powerful story from Story Factory. If you believe stories like this deserve to be heard more, don't forget to subscribe and share your comments. Because there's a Frank in every hospital, and second chances are always possible. As Story Factory, we will continue to be the voice of silent heroes. See you in the next story.